welcome all of you. Welcome to AT Achievers 2, the second session. And today we are meeting Dr. Sonal and Dr. Shrikanth in B Tower P808. And I would like to give introduction to for both of them. Dr. Sonal, she has the unique distinction of being the only lady pediatric neurosurgeon in Mumbai. And she has got amazing educational qualifications in neurosurgery, pediatric neurosurgery distinction in that. And she has her areas of specialization include brain tumor, epilepsy surgery, meningitis, head injury, etc. etc. And it's a long list of specialization actually. So it's very nice to have some interaction with her, to know about her area of specialization and how her knowledge and can be utilized by all of us. And now we will be talking to Dr. Shrikanth. Dr. Shrikanth is a consultant Uro-oncologist and a robotic surgeon. And he has currently operated on in some of the eminent personalities also. And he is regarded as one of the very expert robotic surgeon in Uro-oncology area. So it will be nice to hear his views on, especially on men's health, which can be of general help to all of us in clinicians. So now we are starting a discussion with Dr. Sonal first. It's really good for us to have this discussion with her because she is such an expert in her field, and I think all of us can know some things from her which can benefit us in our day-to-day life. And since she is a pediatric neurosurgeon, so it will be good to understand about children's brain development, what all things we can do as parents to take care of our children. In case of injury, what all things can be done. So we will ask some of these discussion points or questions around these topics. So Dr. Sonal, thanks a lot for agreeing to do this session for the benefit of all AT residents and others. So we'll start with the first very general question that for children, as we understand that in the initial years, most of the brain development happens for the children in the very first few years, right? So what all precautions we as parents or grandparents can take for good development of their children's brain?
First of all, I would like to thank Mr. Ladda for the opportunity and the initiative. And the brain development happens, about 70% of it happens in the first 2 years. 90% of it happens in the first 5 years. And then the rest of the development, only about 10% happens from 5 to 15 years. So the majority of the focus when parents should actually give time to the kids is between first 5 years of life, and especially the first 2 years. Often it's said that when a small child performs very well, it reflects the parents and the grandparents' attitude at home. And this is essentially the reason, because kids are so fast learners. Every day they can learn a new word, every day they can learn a new fact. So the first 5 years are crucial, and the maximum efforts should be put in those 5 years. The best ways to go about is to expose the child. The child is like a small Pandora box. The more you expose, the more they absorb. So the child should be exposed to variety of cultures, languages, and hence it's also said that Indian children in general are more faster and more brilliant because they are multilingual. So the more the child is exposed to languages, the more difficult pronunciation is, the more the child's brain adapts. Also, the brain is quite plastic and flexible, meaning the more challenges are thrown at the brain, the more better the brain gets at it. So, how much ever the child could be exposed to new learning, new friends, new environments, parents should not be afraid of it, but they should encourage it. Definitely, every child is special. Every child has his or her own limitations and capabilities. So, we should take that into consideration as well. And according to every child, the parents and the family should adapt. It shouldn't be over stressful for the child to go through that period, but it should be enjoyable and it should be learning while playing and enjoying it. So the basic facts that we can do is expose the child to multiple languages, expose the child to multiple people, avoid screen time, excessive screen time. The rule is 20 minutes. Once the child has a screen time zone, then there should be a break, compulsory break. So continuous screen time is not at all advisable, and exposure to all kinds of things, plays, study, some religion, some language exposure, everything together helps in brain development.
Very interesting. So it's good that you raised this topic of social media and screen time on children, and probably the harmful effect it has on children's brain development, right? And I think all parents, grandparents have been grappling with this. I mean, it's not that we all are not slaves of screen. We ourselves are so addicted to screens. But I think it's very, very important for our children's development and their brain development that we really limit it and control it, right?
Absolutely.
So would you like to elaborate a bit more, like if a child is spending a lot more time on screen, what does it do to the brain?
So there are multiple effects of screen time which extend from a direct effect on the eyes, on the brain, and to the social attitude and behavior of the child. To just summarize them all, once somebody, for example, it happens in adults also, once we get glued to a screen, we forget where we are, we forget the people around us. So this social isolation which sets in so early is very harmful and detrimental. Also, screen exposure is in general works like a chocolate. So chocolate is enjoyed by majority of children. Similarly, screen is enjoyed by majority of children. So it takes away the time that they can put into better things, and invariably they get addicted, sort of addicted to the screen. Also, once somebody refers to a screen, it's very difficult to control the content which the child absorbs in.
Right.
As against a child being exposed to grandparents or neighbors or friends. That content is very different from what the child gets in the social media. So definitely when we are considering a child's brain, the cognition, the understanding of the brain, the processing of the brain, the information which gets in and then gets stored in the brain, all of that is affected.
So Dr. Sonal, I also want to ask you a very interesting question about brain in children, how the brain develops. So when the child is in a fetus form, then what happens? Can child's brain grasp things which are happening in the outside world? I'm asking this because all of us know the story of Mahabharata where Abhimanyu grasped, he could hear whatever was being told to his mother, right?
Yes.
So does it really happen?
It does happen, and interestingly, I have a publication on fetal brains. I've studied fetal brains in general, and fetal brain development happens mainly in the second and third trimester. So the first trimester is when the structures are being formed, and the development and the enlargement of those structures happens eventually in the second and third trimester. So the hearing and the understanding of that hearing and then utility of that information happens in the later half of the pregnancy. And definitely it is useful to hear good things, be in good vibes, because it affects the brain development of the child. Also, it is important to know that whatever the child hears, the child does remember. But finally, stimulation is the key for brain development. So the more the child is being stimulated, the more people come and talk to the child. Even when the female is pregnant and carrying the baby, the more the child's brain develops and he remembers things later as well. So that stimulation is the concept for development, holds true even in pregnancy.
Oh, so even if the mother is in a good social interaction mode during pregnancy phase, it helps the development of the fetus brain?
Yes, it helps the development and it helps the child recognize the people around him or her better.
Oh.
And yes, and the brain, the neurons of the brain work on electricity and electric circuits. So the more the exposure is, there is more circuitry which is formed and the more the information is stored eventually.
Okay. That's I guess very, very interesting to know.
It is, definitely.
Dr. Sonal, another question which I want to ask you is that last 2 years because of pandemic we have seen that children have stayed at home there was no school, there was hardly much of social interaction with their peers, etc. So it must have impacted the children's brain development to a certain extent, right? So what all things parents can do now to really take that effect, adverse effect out?
So thanks for that question, Mr. Lada. There has been objective evidence in literature, medical literature, that post-COVID era children are socially inhibited, they are more shy, they are less likely to form friends and have better social interactions compared to children who have been in pre-COVID era. These children have difficulty going to school, adapting to school, so there are many things that parents can do. Actually, we have had a session on COVID and children where we have highlighted these points, and the same is there on YouTube. So the main important points are that take it slow with the child. There are many children today who haven't been to an offline school, and for them online school is the norm rather than an offline school. So this transition will take some time. They need to be given space and comfort and slight amount of time, and as and when they interact with other children, school is somewhere a natural instinct. So eventually children will get adapted to it, eventually children will be fine, but then as and when we see some red flags, like the child is not able to cope up or the child is socially inhibited, there are excessive amounts of crying, or the child doesn't know how to behave in general in a social circle, one can take help of a developmental pediatrician or a developmental neurologist, and school is a very mild form of cognitive therapy where children come together, a teacher teaches them, they are away from parents and they learn things on their own. If and when children need more aggressive or more slightly higher forms of therapy, then there are multiple options available and one should not be stigmatized to use those options. So definitely post-COVID, parents can help their children by giving them time, by having play dates, having friends, less screen time again, more time with family, friends, relatives, so that they become used to the social interaction that used to exist and thrive so much in India before COVID. And if and when they see red flags or they see that their child is not improving, say in a time of about 3 to 6 months, they should seek medical help.
There was this movie Tare Zameen Par, right? And I think that movie specifically talked about children's brain development, learning disabilities, and what care parents can take in those special situations, and in general also what they can do for their kids. So, any general advice would you like to give to parents that like giving more time to their kids, sitting with them and doing puzzles with them, or helping them in studies, etc., etc. While we understand socially that these are good things to do for any parent for their child, right? But if you would like to tell a bit about from a medical or in brain terms, what does it do to a child's brain? I think it may be helpful for people to understand.
Just to reflect back on the way the brain functions, most of us are right-handed, so our left brain is dominant, and left side of the brain mainly controls language, memory, the way we process things. The right side of the brain is more of the artistic one, the one which coordinates with hand, face, visual memory. So every child is different. Some children are right brain predominant, some are left. So we need to give the child the time to tell us what is his or her capabilities, and accordingly the parents should focus on those and help the child get better in them. A simple example is Lata Mangeshkar cannot be Sachin Tendulkar and vice versa. So depending on the child's area of interest and speciality, the parents should work on them. So definitely solving puzzles, doing things together, playing a sport together, spending time together in general, sitting down after dinner and speaking to each other, all of those make a lot of difference when it comes to child care. But eventually, each and every child has his or her own way to do things, and nobody else is the best judge rather than the parent himself or herself who's been there with that child through and through. So yes, give your child time. That is priceless and precious, and there's no other better gift than that. And I understand most of us, especially when the child is small, in our 30s, 40s, is is the typical time to struggle with the career and be worried about things, but this time it doesn't come back for the child. So this is the time when we have to give space and accommodate these children according to their level of expectations.
Very rightly said. And I think all of us do understand and or probably need to understand that parenting is a very, very dynamic process. Whether we are parents or grandparents, all of us need to understand that for our next generation's development, we need to devote a lot more time. For example, like in AT, we have such a great facility of the ground and so much open space, but we don't really see too many parents coming down with their children and spending time with them. You know, there are definitely some examples where parents are playing cricket with their children, or doing cycling together, etc. But I think in our complex, this interaction can be more, and this is something which will definitely help us in better parental bonding. So I think it was great to really learn about these things in medical terms and real scientific terms from Dr. Sonal. So thanks a lot, Dr. Sonal. It was really good insights all of us had in this talk.
My pleasure.
So very nice meeting you, Dr. Shrikanth, and learning about you. It's really great to know that Dr. Shrikanth is such an expert robotic surgeon in urology area. So we will talk to him about various aspects of men's health, learning about how to maintain good urological health for people in general, and we will know a little bit about these advancements in these areas like robotic surgery, etc. So thanks, Dr. Shrikanth. Let me start with some very basic questions to start with. Like if you want to speak a bit about the areas and the symptoms of our men's health and what all people should generally be aware of.
So at the outset, I would like to thank you so much for giving me the opportunity. So regarding the men's health and urinary symptoms, the urinary symptoms especially they are more common in older age groups, and starting from them they can be like increased frequency of urination or urgency, so that they feel the urge to go immediately, and sometimes they could not control that urge, and then they leak while going to the bathroom. That is called as incontinence. These are actually called as voiding symptoms. And then there are some obstructive symptoms, like the patients experience poor flow of the urine, like rather than the flow going in front and falling towards the wall, the flow falls in front of the shoes. Or there will be an intermittency where they will feel that the urine is coming intermittently, or they need to strain a lot, or they will have a sensation of incomplete voiding, so that they will go and have a urination and then come back and feel that no, they have incompletely voided, and they go again. So these are mainly the urinary symptoms which develop in the older age groups as the person ages, and one of the main reasons responsible is prostate, because as men age, the prostate gland also grows, and that is one of the common reasons to develop these symptoms. But apart from prostate, there are multiple factors which may develop these symptoms also, like it may be seen in infections, inflammations. Patients may have stones in their urinary bladder or into the urinary tract, which can lead to such symptoms, or there may be some tumors also which can give rise to this symptom. So whenever a person is experiencing such symptoms, they should consult a urologist or a uro-oncologist, so that they could have a detailed history and physical examination, and thereby treat the problem accordingly.
In case of senior citizens, like some of the symptoms you mentioned for senior citizens, what precautions from a health perspective, as a matter of habits or any other precautions which senior citizens can take to really take care of these symptoms or to maintain good health in this area?
So as I told you, these symptoms are more common as you age. So likewise, the senior citizens are more likely to develop these symptoms. But the general concept is that like as you grow older, you are bound to expect these symptoms, and then you ignore kind of these symptoms. So that is where you should be very cautious that it is not related to the aging. Like it is related, but there may be an underlying cause. So we need to find that cause and treat that cause, so that you have a better life afterwards, So especially mainly these urinary symptoms, as I told you. And apart from this symptom, there is another symptom called as blood in urine, which we call in medical terms as hematuria, which is one of the warning and dreaded signs. You should never ignore a hematuria. You should always go and consult a urologist or a uro-oncologist, because one of the dreaded cause of this blood in urine is cancers especially related to the bladder. So most of the people attribute it to the infections or related to the aging, but the underlying cause may be a dreaded problem like cancer. So we cannot ignore that symptoms.
So in our daily life, like it said that we should drink a lot of water,
Yes.
right? We should keep ourselves hydrated.
Yes.
And as a layman, what I understand is we need to keep drinking a lot of water because it acts as a blood thinner at times, and it is good for our kidneys' health.
Yes.
The filtering of blood takes place more efficiently if we drink more water, right? So this is one habit we should do, which can help us in good urological health.
Yes.
Isn't it? Number two, we should not register just call at any point in time. Isn't it? We should always take timely breaks.
Right.
That is second point. Any other things which you think, either eating wise or any other things which you can take as a precaution?
So that's a very nice question, which we often get. So regarding the dietary habits, in general, it is advisable that diet which is good to heart is good to everything. So diet which is good to heart in the sense like the diet rich in antioxidants, like a diet rich in green leafy vegetables or fruits, which is kind of going to protect your heart, is going to protect your body also from the cancers also. So the general advice is to follow a diet which is good to your heart. So that is the basic underlying concept.
And you are, well-known robotic surgeon in this area. You have trained in Tata's hospital here, and you have trained in Miami hospital. Considered to be two probably best, two very good centers in this area. So it's really great to know a bit about some advancements which are happening in this area. How safe are these surgeries becoming, or anything which you may want to speak for layperson's knowledge about this.
Yes. So before going into the advancements, I would like to just talk about the annual general health checkup.
Sure.
So apart from maintaining good health and maintaining good healthy diet and habitats and exercise, you still need to emphasize on an annual general health checkup, because you never know, like even though you are doing good by having a good diet, having a daily exercise and everything good about your body, still you may be prone to develop some cancers, which it is not in your hand, it is the genetic makeup of the body. So how would you pick up those cancers? So those cancers should be picked up at a stage early so that we can cure it, So the only way is to have an annual general health checkup, like they should undergo at least a blood test every yearly. We should undergo an ultrasound of the abdomen and pelvis. And for the prostate cancer point of view, it is generally recommended that after the age of 55, you should at least get a PSA test, which is a blood test, only a simple blood test, but very good in detecting prostate cancer early. This is because, all early detection, which will lead to an curative form of the treatment for the cancer, and that will prolong your life. So, for giving an example, if you see for the kidney cancers, especially in the good olden days, they were found at a very advanced stage, when the cancer is very big, it is felt into the abdomen, and then it gets spread and all. But now with the advancements in our technology, like ultrasound and CT scan, where even if a normal person suppose gets a pain, which is having an abdominal pain, so and then he goes and gets an ultrasound done or a CT done, then he gets incidentally detected this renal mass, which is called as a kidney mass, and which is like unless proven otherwise is a cancer. So the incidence of these incidentally detected kidney cancers has like a rise, and a very steep rise was there in the last 1 or 2 decades because of the use of this ultrasound and CT scan. So my advice would be to generally do the annual health checkups, do the blood tests, and do the ultrasound of the abdomen and pelvis, and get checked up with any physician, so who can help and you and detect this if anything problem is there. Coming to the advancements in the surgery, age old it was an open surgery, and we were taught that big surgeons take big incisions. So that was the norm few decades ago. But gradually then the minimally invasive surgery came, like laparoscopy came, and apart from laparoscopy, had some disadvantages also to it. And to overcome that disadvantages, now the robotic surgery is there. So robotic surgery is a kind of a minimally invasive surgery only, but which overcomes the disadvantages of the laparoscopic surgery. Like you have a great vision, the camera which is used in doing the surgery is controlled by the surgeon, and then the instruments of the robot have the movements of the wrist of the surgeon, so you can go in any deep areas or difficult areas to reach and do the surgery with ease. So this has improved the precision, the accuracy, the dexterity, and which will lead to improved results. So this is the latest development in the urological cancers, especially the robotic surgery. But I would like to emphasize here, the robotic surgery does not mean that the surgery is done by the robot. It is just a tool. The surgeon does the surgery, the robot just acts as a tool. So that's how the game-changing today is robotic surgery in urologic cancers. Recent advancements, like recently now in April 2022, we have had a publication from John Hopkins where the robot itself did the surgery without the help of the surgeon.
Oh, okay.
So that is the AI coming into the picture. So artificial intelligence is coming in a big way. It's still very in a premature stage, but I can see after down few decades, it's going to play a major role.
Oh, very, very interesting to know. What kind of future we are going to have where artificial intelligence is going to be our surgeon at times. So I think it was very good insights, Dr. Shrikanth. Thanks a lot for these answers and discussions. One last question, Dr. Sonal, I have is, brain surgery is considered to be probably the most complex piece in the whole body, human body. And in general, as lay people, we have a lot of misgivings or understandings or complexes about brain surgery, right? And so, would you like to say a bit about what kind of advances are happening in brain surgery, how things are becoming safer or better?
Sure. So I wouldn't compete with the advancements of Dr. Shrikanth, but there are equally good, if not better, advancements happening in pediatric neurosurgery. So to give you a glimpse of what all we can do, just like Google Maps exists, we have neuro navigation for the brain. So it's a computer-assisted navigation which is based on MRI, which is done with a wand like a stick, and we can move it and know where we are in the brain. There are minimally invasive surgeries also for the brain now. There are robotic surgeries also for the brain, and the most advanced form is incision-less surgery. So just like to give an example, how stones are now broken with ultrasound. A person has stones, they go into a pool of water and then ultrasound is focused and the stone is broken. Similarly, in the US, not yet in India, but eventually it's going to come for sure, ultrasound rays are focused at one point in the brain using MRI, which sort of destroys the lesion. So the child goes into an MRI operative suite, meaning that the operation happens in a room where MRI exists. And that facility actually is still there in Mumbai also. And while the child is in the MRI scanner, the surgery happens. And ultrasound rays are focused using navigation on the lesion, and they destroy the lesion, and the child comes out of the MRI machine, no incision on the head. And this was actually a part of pivotal trial, so I have been fortunate enough to be a part of that trial. So we have seen this happening for sure. It will undergo FDA approval and then come down. The other interesting development which has happened is a device which is known as Neuro. So just like people who have irregular rhythms of the heart, they have a device known as a defibrillator. So what it essentially does is it recognizes the abnormal rhythm of the heart and it stops it. Similarly, in the same vein, there are devices which recognize the abnormal waves of the brain and they stop them. And that's what essentially epilepsy is. So there are a lot of advances which are coming, but as Dr. Shrikanth said, a tool in the hand of a fool is not the best tool. So the surgeon is behind them all, and as long as the surgeon is aware of the best interest of the patient, best optimum use of the tool,
Right.
only then the tool can perform.
That's
So AI is coming, we are very happy about it, but they still need our blessings, and we will be more than happy to give them.
yeah, very good way of describing it. Very nice.
Thank you.
So it was a great session, Dr. Sonal and Dr. Shrikanth, to have these insights. You are young doctors here who have come to 80. They have been in 80 since last almost 2 years or so, and they are experts in their field. So I think it's really great for all of us 80 residents to have such co-residents expert in their field, and all of us can learn some things from them. Hopefully this session would have been or it would benefit you all in some ways. There's one more point I want to state to both of you, because both of you stated about ultrasound as a as a source or a means to come out of disease, to cure disease, and it effectively talks about the certain level of frequencies on how it can affect our health. And I'm myself a big proponent of pranayama and yoga and all. And having read this in our Ved and Upanishad, that the kind of frequencies and sound which with what our rishis used to practice, and that will have a lot of positive impact on the body and brain. So this is probably a topic for some other day. We can discuss in more detail, bringing science and our Upanishad's knowledge together. So with that, I would like to close this session. Hopefully all of you have would benefit from this. It is broadly, it's an amateur effort, so if if there are any mistakes in recording or the session not being too professional, please excuse us. But the idea was to really know about our co-residents, the idea was to introduce the expertise to all of you and bring some benefit to all of you. So with that, Dr. Sonal and Dr. Shrikanth, thanks a lot.
Thank you so much.
Thank you.
Thank you so much for